Well, thank you for joining us again. This is our Friday feature video, and I'm joined this week and this month by Dr. Lauren Cvekovic to my far right, and then Dr. Marguerite Duane, who's one of your many passions, and one of your works is FACS in fertility awareness-based methods. And Dr. Lauren Cvekovic is one of our own here at Tepeyac OBGYN, and we're really pleased to have both of you with us. Our features this month really are boiling down some of the medical advancements that have been taking place here, and really that have helped strengthen and authenticate women's health care in the pro-life movement. And I think it's really amazing the different advancements we have. We've been sharing these articles all month on Fridays, and they've gone from the advancements in sonography to adult stem cells being used, and really it's been amazing to see some of those advancements from your standpoints as practicing physicians. Dr. Cvekovic, where would you say is probably the quintessential transformative to the medical movement that has helped the pro-life movement in your perspective?
Well, I think you can't argue it's always been ultrasound, and as ultrasound gets better and better, that has actually improved our ability to know what's going on inside the womb, which knowledge is truth, and that helps people to see what's going on. So it helps us to make better decisions. But even beyond that, I mean, there are some things with ultrasound we can do now to more specifically identify problems in the woman's cycle and with the woman, so that we can maybe prevent miscarriages, that sort of thing. Other things other than ultrasound, I think of the ovulation predictor test, which has really revolutionized our charting, particularly for women who have difficulties. Long cycles, irregular cycles, polycystic ovaries, and of course the breastfeeding weaning area. It's really been a godsend, and there's been a lot of research done on this now. And so it hasn't actually superseded any of the other NFP methods, but it certainly has added to it. And it certainly makes my day a lot better. Yeah. And you can extend that to the pro-life issue too, in that you want to talk about the menses as the fifth vital sign. It's a sign of woman's health, every regular menses. And behind that is, of course, the ovulation, and more importantly is the ovulation. So those two really are the two primary things that we can use to, give women a sense of their worth and their abilities, in the sense of reproduction, and make them respect that. And if they have knowledge of it, then we can do things in terms of treating ectopics and all sorts of things better if we know when conception occurs, when the next period should come, when the last period was, etc.
Right. Yeah, I would echo that, and to expand on it further. I mean, certainly ultrasound has made a huge difference, but also that increased awareness of the female cycle, and technology has certainly raised that awareness. I mean, the advent of apps, and honestly the proliferation of apps, has brought people, and women in particular, introduced them to the whole concept of charting their cycle and understanding their cycle. It's interesting, when I speak about fertility awareness-based methods, oftentimes I'll speak about each of the evidence-based methods, and the earliest one to be developed was the Billings ovulation method, which was developed in the early 1960s, at the same time as the advent of the pill. And yet over the last 50 years, the oral contraceptive pill has proliferated to the point that almost every single woman is given the pill or recommended to take the pill, not only for birth control, but for a range of women's health conditions. Unfortunately, fertility awareness-based methods or natural methods of family planning have not been as widely disseminated. But through the use of apps and through the use of new technologies and more research that shows the effectiveness of fertility awareness-based methods, we are seeing a greater awareness and greater applicability. It's unfortunate, because I do think, while the pill was touted as liberating for women and helpful to women, in many ways I actually think it halted real research into better ways to diagnose and treat a range of women's health issues. I mean, the birth control pill really seeks to suppress symptoms. It doesn't seek to get at the root cause and the diagnosis. However, as Lorna mentioned, with charting the female cycle really serves as the fifth vital sign. And in fact, we actually have a presentation called The Female Cycle is the Fifth Vital Sign. And we teach our healthcare colleagues how when women chart their cycle, we as medical professionals can learn to read that chart just as you learn to read an EKG in a very systematic, standardized fashion to identify what is normal and what is not. And if there are any abnormalities, that's going to signify something deeper. Again, ovulation is a sign of health. A woman will only ovulate if her hormones are functioning properly. If they're not, we will see this manifest in the signs of the chart. And this is where I think actually charting on paper, charting with an evidence-based method is so much more valuable than simply pulling out an apps, because the apps don't really give women the information they need to truly chart their cycle effectively. And it's difficult as a medical professional to really be able to see the patterns over time, as opposed to just the day-to-day. So I think in addition to ultrasound, certainly the advent and the increase in awareness and access of fertility awareness-based methods and the additional research on how these methods can be used to address women's health care has significantly advanced women's health care and helped for couples that are seeking to achieve pregnancy, that really have a goal of bringing new life into this world, but who may be struggling or dealing with a range of issues.
Yeah.
So it's been incredible.
No, you're right. Both of you, great points. I think the sonography is great. Even you get into the 3D and 4D, and really what that helps to do in utero to treat a potential or to get ready for once the baby is delivered, to be able to have the professionals in the room at the delivery time, and you think about the use of the apps. What else? What's on the forefront? What is there anything out there that they're researching that maybe hasn't come out yet, but we're kind of eager to see and find out what's that next thing? Is there anything out there that you've come across, or that maybe is recently developed and is really starting to become more mainstream?
I mean, I would go back to, I think there's been an increased emphasis on focus on the endocrinology and understanding the hormones of the female cycle. And rather than suppressing them with using artificial hormones, using bioidentical hormones to target treatment. Just recently I've seen some patients with PMS or premenstrual syndrome, which is a very common condition. And the recommendations typically recommend the pill to shut down her cycle, antidepressants to help manage the mental health symptoms, but it doesn't get at the root cause, which is insufficient levels of progesterone. With newer fertility awareness-based methods and the training that we can receive as medical professionals, we can learn how to use bioidentical progesterone to use it to treat the woman during the luteal phase. Again, getting at what is the root cause, treating the underlying symptoms. So instead of exposing the woman to the side effects of antidepressants or birth control pills 365 days a year, you can use, supplemental progesterone. And there's more and more research now being done. And we need more and more research. I mean, there still certainly is a role for antidepressants, and I don't want to discount that. But I think using the pill to simply shut down or suppress the symptoms isn't in the woman's long-term best interest, because it doesn't get at.
It's a quick fix
that doesn't necessarily treat the underlying cause. So I think the additional research, and now they have the advantage of laparoscopy to be able to address things like endometriosis. With polycystic ovarian syndrome, we're now seeing a resurgence in surgery to address polycystic ovarian syndrome. And so the bottom line is, there are things on the horizon. We absolutely need more funding and dedicated towards researching these that, again, approaches to women's healthcare that really seek to restore, identify the root cause, treat the underlying disease, and restore the woman's reproductive health system to its normal state.
Right.
In fact, there's a brand new organization. It's only about maybe 5 years old. That's it's called Restorative Reproductive Medicine.
The International Institute of Restorative Reproductive Medicine, and that's one of the things they're focused on, is doing research in this area.
That's great. What would you think is the connection as we move forward in some of the research that has been done around this? Do you think, are you finding that things that were a mystery to you. I mean, you've both been practicing medicine for 10, 15 plus years, and what is, in your time of practicing medicine, how has technology been really helped you transform the way you treat patients, the way you even approach patients? And if you could walk me through some of that.
Well, I think for one thing, polycystic ovarian disease is much less of a mystery than, it's still a bit of a mystery, but much less of a mystery than it used to be. And we really know how to treat it and why to treat it, and we can explain this rationally to patients. And it's like diabetes. It's a chronic condition, and it's hard to get people on board sometimes. But when you do, you see some incredible benefits in terms of health and fertility. So I think 20 years ago, we just didn't know why people had all these long cycles.
Right.
And for a long time, we knew what PCO was, but we didn't really understand very much about it or how actually to treat it very well.
Right.
I think that's been a big advance.
For me personally, I'm a family physician, and I chose to pursue family medicine because I liked the idea of, the broad spectrum of care. And during my training, and I think this is probably somewhat true in training for OB-GYN residents, we really were trained to approach the woman's health cycle and any irregularities in the woman's health cycle. We were trained that the pill is the panacea for all that ails women. So if she had PCOS, put her on the pill. PMS symptoms, put her on the pill. Painful periods, put her on the pill. And since finishing training and now pursuing more education through fertility awareness-based methods, I've recognized that women's health conditions and concerns, have a myriad of underlying causes and a myriad of different treatments. And women deserve medical professionals that are really willing to work to investigate and treat the underlying causes. And so in many ways, though I didn't pursue a career in OB-GYN, I feel as though I'm becoming more and more of a specialist in women's health, because it isn't as simple, well, here's a pill, and if that pill doesn't work, I'll try a different pill. It's how do I really understand the cycle and work to do that targeted diagnosis.
Like you said before, getting to that root issue and really finding out what's the best path to treating the patient.
Exactly.
How about yourself, Doc?
No, I just think same thing with laparoscopy and endometriosis and laparoscopy. I mean, we've had that for a long, long time, but it's only recently that you'll see secular articles saying, wake up to your 18-year-old who's complaining of terrible pain. Don't just put her on the pill. She may need to be evaluated. And so that has changed a little bit. And I think it's because true professionals, true academics still realize, even though they still give out the pill, that that's not really the ultimate in the best care. It's not the standard of care. And so you will see articles and you'll see little messages and things that, they're paying more attention to this kind of thing, to trying to get at root causes and treating them instead of just pasting them over. And incidentally, all of those other reasons for birth control pills, not a single one of them is FDA approved.
Yeah. Well, this is good. I think I want to wrap things up, and thank you both for coming, but I do want to let everyone know that in the future I want you both to come back, because I think our not next month, but in a future month very soon, we're really going to talk about fertility and how, because for a lot of women it can be a real issue, and it's something that they struggle with couples, and they're really trying to get pregnant, and the ethical issues that do come involved with that, but to kind of wrestle with both the techniques that are out there that are ethically sound, as opposed to ones that are not. So I really appreciate both of you coming, and looking forward to our next visit when we can talk more about fertility.
Great.
Thanks, Rob.
Thank you.